Hi, everybody. Welcome to the Hope Dealer podcast with Dr. Brian Hooten in Dallas, Texas. Recently voted the best new healthcare show in the entire universe as of 2023 and 2024. This is episode 2. If you have headaches, you need to tune in rigorously to what I'm going to tell you because I have had headaches when I was younger. I would have all these sinus issues and my lungs weren't working and it would just pile up in my head. And I had these just ear splitting headaches. And all we were told to do was take medication for it. I've come to find out that doing that, whether it's over the counter medication or a prescription for like migraine medications, I've come to learn that if you take medication for headaches, things on the inside begin to deteriorate immediately. And I'll do a good job of explaining that. Long-term effects of headaches are literally brain damage, strokes, seizures even. And if you talk to somebody that has had seizures or strokes when they were older, more often than not, they'll tell you that they had headaches when they were younger. So I'm going to help you gain ownership over what's causing a headache and obviously, most importantly, what to do about it. Because if you go to the doctor for these things, they have no idea how to truly get you well. Do you know, I had somebody in the office this week who had a headache issue and the doctors shaved off the top of his spine. Like they left an opening on the back side of his vertebrae, thinking that was going to somehow get this kid healthy. Well, the pressure in his head went down, but all these other symptoms started showing up. And today he's dealing with a whole lot worse issues than just headaches. The doctors do not understand what is causing a headache. They just look at the symptom. They're taught to look at the symptom in school, right? That's all they're taught. Then they're taught to treat the symptom in school with some type of medication or drug. Then when they graduate, they're paid to look at the symptom and treat the symptom with the drug. So they're never taught about how to actually get somebody well. I'm going to show you how to heal yourself. And maybe that's worth repeating. Who is going to fix you? Only you. Only your behavior can heal you. And this is not some new age thinking. This has been since Adam and Eve, since we were born. You know, when you were born with this insanely powerful system inside of you to keep you well. God didn't program your genes to give you headaches, even if mom or dad had headaches. So I'm going to go through some examples today of people that had headaches, and I'm actually going to show you some x-rays so I could show you and explain to you what's actually causing these things to begin with. And more often than not, it's coming from the alignment of their spine. Again, the doctors don't look at the cause. So if you've been to the doctor, if you've talked to a neurologist or whoever, they may tell you that I'm crazy. Well, if you want to get better, you have to get out of there. You have to think differently, maybe get a little crazy. But once you hear what we say, once you come in and experience what we're talking about, you'll see that it's not crazy, that I'm not claiming some weird, strange thing. In fact, all I'm saying is that your body can heal. You have to get the interference out of the way. That's what I want to go through today. But the number one thing is, like, if you don't change your mindset, if you don't change the way you're thinking, what does tomorrow look like? If you're having to take medication for headaches, maybe you've been prescribed Inderal or Imitrex for migraines, and those headaches come, regularly, whether it's once a month, ladies, on your cycle, maybe it's worse on your cycle, maybe it's just with allergies. If you're having any kind of headaches, that is a sign that your body is not doing well on the inside. And if all you do is drug it, tomorrow it's worse. 5 years from now, it's worse. And then 10, 15 years down the road, other things have started to happen, like memory loss and brain deterioration and God knows what else, maybe some numbness in your fingers and everything. I've seen all of it. You have to change your mindset, think differently, and get into a place like ours that can help you get well. So I've got an analogy, and I want to go through these people real quick. We have the Will Hoyts. Hopefully they see this podcast. Hi, Brian. Hi, Elizabeth. They were dealing with headaches. I think it was Brian that had migraines. So I definitely want to show you their x-rays and explain this. Then you had Tommy, who was prescribed Inderal, which those drugs for migraines, they give you heart problems. I mean, it even says on the drug label warning box, that says this drug causes heart problems. And then Eileen, who, if you've been in my office, she works for us, the wonderful Eileen, she had headaches. So we're going to show you their x-rays and explain to you how this works. So all three of them, they realized, okay, something's wrong with my body or my garden. If you've heard podcast number 1, I talked about this a lot. So I'm going to go through this garden analogy several times so you can get it into your head. Picture your body as a garden and your brain is up here with the water supply. And God designed your garden to need the perfect flow 24/7. And then your spine, your spinal cord, would be the hose connecting your brain to your garden. Okay, easy to understand. Now think of your garden out there. Maybe you've got roses and lilies and pineapple trees, whatever's in your garden. And this water's flowing, everything is flourishing. It's wonderful, it's all growing. Well, if you shut off the water, what happens to your garden real quick? It's over, right? Well, if you take the hose and you kink it, let's say a little bit, 10%, 20% or something. So some of the water is now not getting through. What happens to your garden that way? What would happen to some of the leaves? Some of the plants, they may not die immediately, but they begin to struggle. They'll wither a little bit. You'll see some browning in the leaves. Now the garden, your body is hurting. Well, in the case of headaches, it starts to hurt. So you go to the doctor, and instead of trying to get your flow going, here's your drug, here's your drug, here's your drug. And even if the drug covers up the headache, they haven't stopped this problem in your spine. This is what we call subluxation. That's still there, that kink in your hose. Obviously, your garden is going to get better or worse that way. Worse. This is not like I said, it's not some weird new age thinking. Think about it. If you choke the hose or choke your spine even a little bit, your body is going to struggle. Nobody gets away with that. It may happen quietly. You may not realize that there's a problem in your neck or your back. You may not even feel it, right? If your garden is struggling, that your body's telling you there's a problem in your flow. And like I said, we'll show you the x-rays of these three people. And they're all three different. I couldn't look at the x-ray and predict headaches. But once that block is there, now you got two problems, right? Because you got your garden. Well, in the case of headaches, your brain needs your garden to flow back up the hose, right? It's a two-way street. Like your brain can't live without your body either. It's got to have oxygen. It's got to have nutrients. So the hose, if you will, your spine is a two-way flow. Well, if your brain is starting to run low on nutrients from your garden, the brain starts to suffer. And that can show up as headaches, as swelling, as seizures, you name it. Also, as the brain has its own metabolism, it will digest nutrients, and then it will get rid of waste products through the hose, if you will. If that's blocked up there, now you get this backup of waste products. Now you're staring at dementia. And the people that study this kind of thing, they understand it's a buildup of waste products in your brain, and it'll accumulate around certain areas of your brain, and the brain starts to die off. It's scary, but that happens slowly. So you want to keep your spine flowing, even to help prevent that. Yes, we've had people come in here with early stage dementia, headaches, you name it. You get this flowing, and who fixes them? Am I fixing anybody? Am I healing anybody? Absolutely not. All I'm doing is getting the spine to flow and coaching you how to keep it flowing so your body can fix itself. And it's really no more magic to that. The magic is already inside of you. You just got to get out of the mindset of treating this headache, letting it fester, and then taking a drug for it. Once you get into an office like ours, and unfortunately, you can't just call any chiropractor. If you go on Google or whatever, there's 10 million of us out there. 1 out of 1,000 are practicing the way that we practice. Most people, they go to chiropractor and it's a symptom treatment. You got these, fly by night, you've got these little jack in the box type chiropractors. You got a lot of chiropractors just insurance based. Now you've got chiropractors doing injectables like semaglutide for diabetes, and that stuff has a horrible effect on your brain and your heart. Just look up the side effects on that one. There's a big class action lawsuit. So don't just trust your health to any chiropractor. Get to the one that focuses purely on helping your body heal itself. Now, there's a few of us around town. I'm in the Texas area, North Texas area. So if you live anywhere in Texas, call us up. I was just talking to a young man, and he's going to bring his mom in from California for a couple of days just so we can get things going in the right direction and then help her find somebody back home. So if you're dealing with these headaches, the time is now. If you don't change what you're doing, tomorrow's a little worse, 5 years, you know the story. You're going to hear me say that like a broken record over and over again because I see what happens when people are 30, 40, 50 years old and they haven't done anything. I was a sick baby. If you didn't hear the first podcast, I was that kid. I was on all these medications for lung problems. I had some weird name for asthma, Goodpasture syndrome. I had to do this steroid inhaler at the doctor's office every quarter for 30 minutes or I'd wind up in the hospital. And my parents were, losing their hair over this thing because they didn't know what to do. No doctor, my pediatrician wasn't telling me how to get well. Well, when things got really bad at 13, an x-ray showed that my spine was curved. Now, we knew it was curved because every time I had pneumonia, they x-rayed my chest and we saw that curve in there. The doctors didn't say a word about it. And the special type of chiropractor told us, this is why you're sick. And we started taking care of my spine at 13. Before you knew it, I was breathing better. I was off all that asthma. The sinus headaches stopped. I haven't had one. I just don't get them anymore. Now, when the weather changes, I might get a booger once in a while, but that constant drainage at night, waking up with a stuffy head, that's been gone since I was 13. So if you're dealing with sinus headaches, if you're dealing with migraine headaches, maybe it's cycle headaches, we can coach you and show you how to get out of that. But you got to come and see us. So make sure you study the films, make sure you understand that. Hopefully it's real clear. If you have any questions, obviously when you come in, I will walk you through it. We'll treat you just like family. This is Dr. Hooten signing off. We'll talk to you next time.